Some families are hosting so-called COVID parties. It's where groups of parents get their kids together to intentionally expose them to the virus. Back in the day, some people used to do this with chickenpox to build up some sort of natural immunity. But medical experts told health and wellness reporter Sonia Azad, you should not be doing this.
Current data shows us the majority of children who become infected with COVID-19 do not get severely ill. This may lead some people to think young people can get away with intentional exposure without severe consequences. But it's not that simple. First, because your kid could pass COVID to other kids or adults. And if any of those people have weakened immune systems, they could get really sick, require hospitalization, or even die. Next, at this point, we know that it is possible to get reinfected with COVID. So exposing your child to COVID-19 on purpose doesn't mean they'll be protected from getting it again. Third, the long-term consequences of a COVID infection are still being studied. There's no way to predict who might have life-threatening complications down the road. Estimates of how common long haulers or long COVID is in children varies widely. Data released by the UK's Office of National Statistics this spring showed 9.8% of children ages 2 to 11 and 13% of young people 12 to 16 reported at least one lingering symptom 5 weeks after a positive COVID test. Finally, hospital resources are already limited. Staffs are stretched thin, and more really sick kids would put added pressure on healthcare systems. So if you hear about COVID parties, doctors say steer clear. Intentionally exposing anyone to a virus, especially a new one like COVID-19, is not a good idea. With your health check, I'm Sonia Azad.